Hey folks, I'm trying something a little different today. I figure as much Zoom and WebEx I've been doing and using the camera on my laptop that I ought to be able to manage this video and post it to YouTube myself. We'll see. So today is Friday, June the 12th, and this is my weekly message to you today. I'm going to do it in three sections today. Um, I'm first going to give you an update around COVID-19, and then I'm going to give you a general CareSouth Carolina update, and then we're going to talk about the topic that I went into last week, the racial injustice. It was a hard video for me last week, and I think I've got a little bit of control of myself this week, but we'll see. So, when I'm talking about the COVID-19 update, I want to first start with, the task force that I've spoken a lot about continues to meet. We meet Monday, Wednesday, and Friday. We continue to look at data very, very closely. I believe that John Douglas has done a video message to y'all also, and he is doing a deep dive into all of the data that he presents to you on his weekly digest. That data is very, very important. It is very important for all of us to be mindful of that data. And what we on the task force are seeing are some projections that are based on the recent increase in cases and deaths. Now, I know a lot of people say, well, the cases, the positive outcomes are increasing because there's a lot more testing around that area, but these projections and these numbers adjust for that. All of the entities across the nation that have done this data crunching and this data analytic um, have gotten real sophisticated. So they know how to begin to adjust for increased testing, and they have. And frankly, it's really scary. Um, Sources are predicting that since South Carolina has loosened restrictions considerably, that by October that we may be having as many as over 2,000 deaths. Now that really that's very troublesome. Right now, I think we're in the neighborhood of 500 and maybe 68 or something like that deaths across the state. And that means between now and the end of September, which is not but really 3.5 months, we'll have a substantial increase. That is really, really concerning. And the only comparison we have is when the Spanish flu outbreak happened. And we've all heard those stories. The second wave was worse than the first wave. So we're watching this very, very closely. We are seeing the hot spots that are across the state and particularly in our PD area. We saw some of the consequences of the Memorial Day gatherings just in some of our county reports around the positive cases. What does this mean? Well, simply put, this means that at CareSouth we need to double down. In the past couple of weeks, we have actually had 3 staff that have had positive test results. That's right, 3 staff that have had positive test results. All 3 of these staff did not have any symptoms. They were not sick. They were asymptomatic. So you think about that. Um, that's pretty scary. So by double downing, what do I mean? Well, our temperature checks are going to continue. Many of you have said, well, how come we can't have those forehead temperature checks? Those are simple. You don't have to put anything under your tongue. We tried that. We actually bought a right good bit of those digital forehead thermometers, the laser ones, but they turned out to be not accurate. I'm really sorry they didn't work out. And we can't order, well, there is a back order of all the ones that are at medical grade. The only thing we could lay our hands on early on was those that were really for residential use. And they simply were not accurate enough for us to be confident that we were doing the right thing. So I'm sorry, folks. We don't have those laser digital forehead thermometers, but we have to continue with temperature checks. We have to continue with masking, and I want to issue a warning and a plea, a begging to you all. Mask at work shouldn't stop just when you leave work. Please, please continue your masking when you're at home and out and about in public. The same thing goes for social distancing. We're going to double down on that and make sure that we're all very, very aware and practicing stringent social distancing. I understand the problem. I too, uh, feel like, well, I'm wearing a mask, but it's essential. And once again, it's not just while you're at work. It's when you're out and about. I hear terrible stories, and I know what you're all faced with. It's not so much as what I'm faced with, because frankly, I am at high risk, and I'm staying at home as much as I can. Uh, I don't need this disease. My high risk is my high risk. Don't tell anybody this, but my high risk is because of my age. Mm, I don't have any really underlying health conditions, but that's the reality of my birthday. So please, please be careful. I know that you are hearing things out in the public, and you might even be being subjected to um, ugly comments and everything about your mask that you might be wearing or the distance that you want to keep. And I know it must be hard, but please, please keep it up for your safety and for the safety of all of those of us both working at CareSouth and in our communities. The weekly lunches are going to continue. Uh, I I I wish that we could do more than the weekly lunches. I heard back from a lot of you about your paycheck last Friday, how appreciative you were, and I really also liked hearing that. You know, the executive management team was not eligible for that pandemic incentive, and because we felt like that it was very, very important that that go to the staff. So testing now. I'm gonna shift gears. Testing, testing, testing. Testing is still full stream ahead. Our collaboration with DHEC is still full steam ahead. We did a testing event in Bennettsville this week on June the 9th. We had over 400 tests that we did. I can't remember, but I think it was actually over 450. We've got another one in Chesterfield coming up next week on the 18th, which I think is a Thursday. That'll be at the Chesterfield High School, and that'll be a big testing event. We'll get out a lot of promotion. We'll ask the community to come and join us in that testing event. We've also got some that are on our radar screen that will be scheduled in the very near future. Coker College in Hartsville is one, and the Round O Missionary Baptist Church, which is kind of between Society Hill and Darlington. We'll also be doing a testing event with those folks. So we've got a lot on our plate in terms of testing. We will continue as our supplies allow the drive up testing that we're doing in all of our various locations. And I am really excited that in one of our grants that we got uh, for the CARES Act, the stimulus that Congress approved, one of our grants is allowing us to purchase these mobile vans. Now, these aren't vans that patients go into, like the ones that we called our mobile roads team vans. Instead, these vans are going to go out and they're going to carry a team of CareSouth Carolina staff with them. Staff that'll probably be mostly lab folks, nursing personnel, other administrative or community outreach folks. And they're going to go around and do these mobile testing events, small ones, not like the hundreds and hundreds that we've been doing, but we're going to work with churches and other community organizations that may want us to come out and spend a couple of hours and test maybe 20, 30, 40, 50 folks in these little mobile outreach vans. I'm really excited about that. We are buying 4 of them, and Care First Foundation has secured donations from a variety of sources, and they are going to be purchasing the 5th van for us. So we'll be having a van really essentially for every single one of our counties. I think that's really cool. Our first priority, although it's going to be for coronavirus testing, we'll also be able to use these vans to go out in more localized versions and offer patients who don't want to or can't come into our offices for chronic disease testing, for hemoglobin A1C, blood pressure checks, all those kinds of things that are essential to manage our patients but are often hard for them to access, even HIV testing. So I'm really looking forward to that. We expect the first van to be delivered around after the 4th of July. So really look forward to that. I think it's going to be a new dimension of us being able to care for patients in another manner without just having to look at 4 walls. So join me in that excitement. We'll keep you updated on that. Many of y'all have heard and are seeing a lot of the efforts that we're taking to redesign how we care for patients, how we embed the things that we've been learning in this coronavirus epidemic, pandemic rather, things like telehealth, telecommunication, things like these mobile testing vans that I talked about, things like doing drive-through at our various sites. We're really brainstorming on how we can continue some of these innovations and how they can become the way we do business at CareSouth. It'll be different. This is an unprecedented opportunity to really think about how we want to look at care in the future without having packed waiting rooms, without have to have patients come in to see us. How can we redesign this and really end up being more patient centered? We're working on it. We don't have all the answers. Uh, Nobody, as far as I know, has all the answers, but there's an awful lot of people that are working on this. So I look forward to how this can become the new future, the new normal, as somebody call it. So I'm going to switch gears now, and I'm going to talk about the topic that I began to speak about last week, and that is the issues that our community are facing. I called it the plague of racial injustice. Uh, I want to continue that conversation. Our Wear Black Friday initiative was very, very heartwarming. Susan Hodge, we should really take our hats off to her. And I'm continuing to wear black Friday. It was amazing to see all of those pictures and to see you, many, many, many of you, standing together and standing against this racial injustice, which has just exploded over the last several weeks. Uh, I don't know exactly what that's going to look like. I want to remind everyone of this quote from Martin Luther King that says, and years, almost 400 years, of humiliation, abuse, and deprivation cannot be expected to find voice in a whisper. I'm concerned that we are still whispering, and I don't want that. Our whispers need to become united voices. But the voices are not just um, organized voices. You have a personal voice, and your personal voice is very, very important. Each of you have a personal voice. I have a personal voice, and I choose to take that personal voice and not only wear black on Friday, but continue in ways that are meaningful to me. We also have an organizational voice at CareSouth Carolina. We are going to be doing many things, I hope many things, to address institutional racism. This is a movement that many organizations, healthcare organizations across the nation, are joining hands. We don't have all of the answers, but as we look at ourselves, as we look at our practices, as we look at how we've rendered health care, we're going to take a hard look at where institutional racism has been. Has it been in our employment practices? Has it been in the way we treat patients? No, these are going to be hard questions. These are going to be difficult um, topics to address. But I'm committed at CareSouth that we're going to address that. We're joining in partnership with an IHI Leadership Alliance group that is um, talking about this. Again, we talked about it a couple of years ago, but now we find even more compelling reasons to revisit and talk about this. And we're going to do so. I don't have all of the answers. I'm hoping that what we will end up with are conversations that may be difficult between each other, but it is conversations that will lead us, I believe, and I'm committed to addressing social injustices, racism that has permeated throughout our society and has led to where we are now. Uh, I think I've told y'all before, I'm an old hippie, and I remember those days in the late 1960s and the early 70s. I remember them all too well. But that was 40 some odd years ago. And like I see many of the banners being held by grandmothers and great grandmothers, I can't believe that we have to do this same thing today. But do it we are, because it is important that our voices become more than just a whisper. So I hope that we have lots of folks that join me and join our organization, join together in solidarity with many, many, many other organizations across the state and across the nation, both in healthcare and in other social service settings. We can have a voice. We can have a voice that is more than a whisper. So, in closing, folks, stay safe. Wear your mask. Wear your mask everywhere. Show people that we are committed to ending this pandemic of the coronavirus and ending this pandemic of social injustice. I'll talk to y'all again next week. Remember, if there's anything you want me to talk about specifically, I'm open. I really appreciate getting your emails as feedback. Stay safe, stay healthy. We are CareSouth Carolina Strong.